It's unreasonable to expect people will remain celibate until there's a vaccine for the novel coronavirus. At this point, many are likely weighing the risks of COVID-19 against the adverse effects of loneliness and social isolation on mental and physical health. That goes for both creating potential quarantines with family and friends and having sex with outside partners. Given what we know, and everything we don't, about transmission of the coronavirus and the measures necessary to control its spread, can people resume their sex lives in a way that isn't reckless to personal and public health? Because COVID-19 is primarily spread through respiratory droplets from the nose and mouth, the bottom line is any in-person interaction could lead to exposure. If you're going to be in any kind of close contact, including sex, kissing, holding hands, or even standing close to people whose infection status you don't know, then there's always a risk of transmission, says Stacey A. Rizza, MD, an infectious disease specialist at the Mayo Clinic. Since many COVID-19 infections are asymptomatic, it's especially tough to know for certain whether you, a potential partner, or anyone you come into casual contact with might be infected. Partners who live together are already in such close proximity that sexual activity doesn't significantly impact the risk for transmission either way. Rizza echoed public health officials in urging people to continue following local guidelines. Even as shelter-in-place orders lift, or people choose to step outside them, catching and spreading the coronavirus through any sort of in-person contact with people outside your home remains a serious risk. We can't tell people to never have sex, that just isn't the way we are as human beings. Though early studies have found traces of the virus in other bodily fluids, including stool and semen, it is not yet known whether they are effective means of transmission. Further research is needed to determine whether COVID-19 infection can actually be passed through different sex acts, but these data are moot, given that any in-person contact results in substantial risk for disease transmission, according to a recent article on sexual health and the coronavirus published in the Annals of Internal Medicine. Thinking through your risk of contracting the coronavirus, and spreading it to others around you, should begin before you make any kind of in-person contact outside your home. There has to be some assessment of what risk is acceptable to you as an individual, and what steps we can take to mitigate those risks, says Peter Leone, MD, Professor of Medicine in the Division of Infectious Diseases at Jilling School of Public Health. We can't tell people to never have sex, that just isn't the way we are as human beings. Better to get information out to people so they can make informed decisions for themselves. The first level of consideration, according to Leone, would be whether you or your potential partner are likely to have a bad or even fatal outcome should you contract COVID-19. People with conditions like hypertension or cardiovascular disease, or who are immunocompromised or over the age of 65, should continue to be especially cautious about any in-person contact. Communication between partners about their potential exposure to the coronavirus is also crucial, Rizza says, like whether either of you has had contact with someone who's positive within 14 days or has otherwise spent time in a high-risk setting. Needless to say, you'll also want to trust that your partner is being honest about their own behavior. Safe sex practices for contraception and STI prevention are just as important as they were before, Rizza also notes. Of course, along with assessing your personal risk, you need to assess the risk you pose to others around you should you contract and spread the virus. Everyone, especially those who live with roommates or family, or who come into frequent contact with high-risk populations, needs to think seriously about how their actions affect those around them. If you've engaged in social activities, not just sexual activities, that put you at higher risk, you need to consider how you restrict contact to those folks for whom getting infected would have a devastating impact, Leone says. That's absolutely the bigger question for society as we become more mobile. Monitoring yourself for COVID-19 symptoms, and asking potential partners if they have experienced any in the past 2 weeks, will also be key to assessing risk. But there's no foolproof measure because asymptomatic cases are prevalent. Paying close attention to infection rates in your local area is also important in weighing the personal and public risks of possible infection. Both experts imagine scenarios where partners could either rapid test at home, or get tested for COVID-19 together and wait for the results before having sex or any personal contact. Testing capacity and technology haven't reached those levels, but they very well could by the end of this year, given the current push in development, Leone suggests. Everyone, especially those who live with roommates or family, or who come into frequent contact with high-risk populations, needs to think seriously about how their actions affect those around them. And yes, masked sex is also an option, one that could significantly reduce the risk of infection. If you both wear a mask and you're in a room that's well ventilated, that risk is going to be substantially lower than if you didn't wear masks at all, or had been hanging out in the same room for a while and only put on masks before sex, Leone says. The same guidance about which types of masks are most effective would apply, and they would be most protective if every partner wore one. Ventilation also makes a difference in enclosed spaces, affecting how long viral particles remain in the air nearby. Good hygiene and cleanup are still important, even if you decide to forego masks. Washing your hands before sex, or any personal contact, could prevent transmission through high-touch surfaces even if none of you are actively infected. Washing your body and any toys with soap and water and wiping down surfaces will protect anyone else who may share your space or come into contact with them from potential infection. The fewer sexual partners, or close contacts you have with anyone, the lower your risk of contracting or spreading infection. Engaging with a growing number of new partners, or group sex with multiple partners, is particularly high risk and inadvisable for the time being, both experts agreed. Though testing positive for antibodies doesn't mean absolute immunity, there is early data to suggest that about 70% of those who've been infected with COVID-19 have some measure of protection against getting it again. It's possible that if you're protected, and it's a long-lasting immunity, that we may see, unfortunately, what is sort of a class system about who's free to move around and who's not, Leone says. More reliable antibody testing, and proof of what level of protection antibodies offer, are still needed before we may start to see people being sorted on the basis of previous infection. But in the case that immunity is further proven, only one sexual partner would need to test antibody positive to protect both partners from infection, Leone says. There will be a seismic change in the way we think about casual sex for the near future, Leone says. Because I think you'll want to know, is this person worth taking the next step with when there are these potential risks? Familiar strategies for communication, risk assessment, and resisting stigma that arose during the fight against HIV/AIDS can be the blueprints and learning tools to move forward in a new sexual era, Leone suggests. We have to have those discussions now. Because we can't live with our lives on hold indefinitely.